Hello, today I'll be presenting on the topic Suicide Among Teenagers in Malaysia. I chose this topic because teenage suicide is not only a mental health issue but also a social and moral issue. It involves how we treat people who are struggling, how families and communities provide support, and what responsibilities we have towards the well-being of others. Throughout this presentation, I will discuss the situation of teenagers suicide in Malaysia, its contributing factors, and the challenges in prevention and the moral values that can help us address this issue. To begin, suicide among teenagers is a serious public health and social issue. Adolescence is a stage of life where young people experience many changes both physically and emotionally. And during this period, teenagers may face academic pressure, family problems, bullying, relationship difficulties, and pressure from social media. While experiencing these problems does not necessarily lead to suicidal behavior, several difficulties occurring at the same time can make it harder for some teenagers to cope. Suicide prevention is therefore not only about responding when someone is already in crisis, it is also about creating a supportive environment where teenagers feel comfortable talking about their problems and seeking help. This requires cooperation between families, schools, healthcare professionals, and society. Looking specifically at Malaysia, the situation is concerning. According to the National Health and Morbidity Survey 2022, 13.1% of Malaysian adolescents aged 13 to 17 reported that they had seriously considered attempting suicide. Around 10% reported that making a suicide plan, while 9.5% reported attempting suicide, according to the Institute for Public Health 2023. This figure shows that suicidal thoughts and behaviors are not rare among Malaysian teenagers. However, it is important to understand that these numbers represent reported experiences and do not explain the individual reasons behind them. This is why prevention should focus on understanding the different factors affecting teenagers and providing support before their problems become more serious. There are several factors that can contribute to suicidal thoughts among teenagers. The first is psychological factors such as depression, anxiety, hopelessness, and low self-esteem. The second is social factors including bullying, peer rejection, and social isolation. Family and education can also have an influence. For example, family conflict or excessive academic pressure may increase emotional stress. Another factor is the digital environment. Teenagers today spend a significant amount of time online where they may experience cyberbullying, social comparison, or harmful content. It is important to emphasize that there is usually no single cause of suicide. Different risk factors can interact with one another, making the situation more complicated. Mental health is closely connected to suicide prevention. Teenagers experiencing depression, anxiety, or other forms of psychological distress may have difficulty coping with problems in their daily lives. In some cases, they may develop feelings of hopelessness or believe that their problems cannot be solved. However, one major problem is that teenagers may hide these feelings from other people. Mental health stigma can make this situation worse. Some teenagers may be afraid that their parents, friends, or teachers will judge them if they admit they are struggling. Research among Malaysian students found that depression, literacy, beliefs about mental illness, and stigma can influence attitudes towards seeking mental health help. Therefore, improving mental health awareness is an important part of suicide prevention. Family and friends can have an important influence on a teenager's emotional well-being. A supportive family can provide teenagers with a sense of safety and belonging. When parents communicate openly with their children, teenagers may feel more comfortable discussing problems before they become serious. On the other hand, constant conflict, criticism, or a lack of communication can make teenagers feel isolated. Friends are also important because teenagers often spend a large amount of time with their peers. Positive friendships can provide emotional support, while rejection, bullying, or social exclusion can have the opposite effect. Research involving Malaysian adolescents has highlighted the importance of family and peer support in relation to suicidal ideation. Therefore, creating a strong, supportive relationship is an important protective factor. Another major issue is bullying. Bullying can involve physical aggression, verbal insults, social exclusion, and humiliation. With increasing use of social media, bullying can also continue through messages, comments, photographs, and other forms of cyberbullying. This can particularly be difficult for teenagers because online harassment can reach a large audience and may continue even when the student is no longer at school. Research involving Malaysian school-going adolescents found an association between bullying victimization and negative mental health outcome, including suicidal planning. Therefore, schools should have a clear anti-bullying policies and students should have a safe, confidential way to report bullying. At the same time, students should be encouraged to support their friends rather than participating in or ignoring bullying behavior. Now I'll be discussing on how moral values play an important role in the prevention of suicide. The first value is compassion. We should care about people who are going through difficult situations. The second value would be empathy, which means trying to understand how another person feels instead of immediately judging them. Another important value is responsibility. If we notice that a friend is seriously struggling, we should not simply ignore the situation. We should encourage them to seek help from a trusted adult or professional. We should also have respect for human life and dignity. A person experiencing suicidal thoughts should not be called weak, selfish, or attention-seeking. Finally, tolerance is an important value because reducing stigma can make it easier for teenagers to talk about their mental health. This value shows that suicide prevention is not only the responsibility of healthcare professionals, it is also the responsibility shared by society. Although suicide prevention is important, there are several challenges. One of the biggest challenges is mental health stigma. Teenagers may be afraid of being judged if they ask for help. Another challenge is warning signs are not always obvious. Some teenagers may continue going to school and interacting normally, while experiencing serious emotional difficulties. There can also be difficulties accessing mental health services, especially when teenagers are not dependent on their parent or when services are not easily accessible to them by themselves. Other challenges include academic pressure, family communication problems, bullying, and cyberbullying. Social media can create another challenge because teenagers may encounter harmful or misleading information online. Because these factors are interconnected, suicide prevention requires more than one solution. There are several ways that suicide prevention among Malaysian teenagers can be strengthened. First, schools should provide stronger mental health education and counseling services. Students should know how to recognize emotional distress and where they can seek help. Second, families should encourage open communication. Parents should listen to their children and avoid immediately judging or criticizing them when they discuss personal problems. Third, healthcare services should become more accessible and adolescent-friendly so that teenagers can receive appropriate professional support. Schools should make it easier to strengthen anti-bullying programs and make it easier for students to report bullying. Finally, society should work towards reducing mental health stigma. Programs that improve depression and mental health literacy have shown potential to improve attitudes towards seeking to help Malaysians adolescents. As students, we also have a role in creating a supportive environment. If a friend tells us that they are struggling emotionally, the first thing we can do is listen without judging them. We should take serious expression of suicidal thoughts seriously rather than assuming that the person is simply seeking attention. However, it is also important for us to understand that students are not trained mental health professionals. We should not try to handle a serious situation completely on our own. Instead, we should encourage the person to speak to a trusted adult, counselor, or healthcare professional. We should also respect their privacy and avoid spreading rumors or sharing their personal problems on social media. Sometimes, simply being a supportive friend and helping someone connect with the appropriate support can make an important difference. In conclusion, suicide among teenagers in Malaysia is a serious issue that involves mental health, social, and moral consideration. Teenagers can experience many pressures, including academic stress, bullying, family problems, and difficulties related to mental health. Therefore, prevention requires cooperation between teenagers, families, schools, healthcare professionals, and the wider community. From a moral perspective, values such as compassion, empathy, responsibility, respect, and tolerance are important in creating a society where teenagers feel supported rather than judged. Most importantly, teenagers should understand that asking for help is not a sign of weakness. Creating an environment where young people feel valued and comfortable seeking help is an important step towards suicide prevention.